We're good to go?
I think so.
No. Okay. Well, I know the story, but tell us a little bit about how you became a chiropractor. What led you to chiropractic?
So like as a kid, I went. So typical story, like everyone else. At that point, like I didn't really think I wanted to be a chiro, but
at that point, when you were a kid, like when we were kids, we didn't have chiros around.
We did.
Did we?
Yeah. I don't think it was nearly as popular as it is now, and like we'll probably get to that in a bit later. But we definitely did. I remember going to, and it was kind of like I was playing soccer and stuff, so got adjusted, and she kind of did some stuff like muscle testing, that kind of stuff. With now, when I look back at it, it might have been a little sketchy, but it was just kind of like I could noticeably see that like my strength was like better, just felt a lot more comfortable, and then I can kind of translate
after I went,
which like I could translate that to like my sport, right? Like soccer and stuff, and it just felt better. So that was like a cool thing I experienced as a kid. And then as I went through university, like I was always into sports, like kind of our whole group of friends is, did kinesiology. Through that, I got an internship being athletic trainer, like a athletic therapist kind of thing.
At UIT.
At UIT with the varsity team. And
shout out to UIT.
Shout out to Ridgebacks.
Yeah. Once a Ridgeback, always a Ridgeback.
Always. So yeah, did that. And like, that was a really cool environment. Like I like treating the athletes and just being with kind of like a sports team. I guess like, I couldn't make it pro. So that was my closest shot to being with the team. Right.
Yeah.
So I liked that. And then I applied to be an athletic therapist and chiropractic also. So like got accepted to chiropractic and went with that.
In England.
Like I always kind of, once I got to UIT, I always kind of like had that in the back of my head. Like that's what I wanted to do. But like I never really thought I would get there. I guess like, I just had lower expectations than I did. But yeah, once I got in.
Do you think you were going to be like a doctor when you got into UIT?
No.
But
then again, like,
so your dreams weren't shattered entirely?
No, not entirely. No,
like,
but like
most of us.
That's the thing too. Like I always thought, I applied for physical education too, like to be a teacher and stuff, right?
Oh yeah.
Because like I was back to like the sport thing. Like I wanted to be a gym teacher, like even like a coach, like good old Harvey that we had, right? Like, take the team to like Lhasa or something, right? But yeah, I got accepted for chiropractic in England and took it.
Bournemouth. Yeah, and then did an internship with the EPL team.
Yeah, which was
should definitely plug that.
Sweet gig. That was a sweet gig. Yeah, so I worked at like the academy under 21 and then with the first team too. So there was that first day I went in there before like their practice. They would always come in and get like treated, whatever, right? Physio, or chiro was there and stuff. And Boruc walked in, like the Polish national goalkeeper, and like I was fangirling hard on the inside.
You look, let me adjust your bag, sir.
But yeah, we were just like chatting in Polish too, like like I kind of brought her, like I saw him right away, and I said like dzień dobry, which is like hey in Polish.
Like hey, I'm also Polish. Let's be friends.
That's exactly what I was trying to like nudge at him, right? And then we just like kind of had a solid like 10-minute conversation with him, which was pretty sweet. Oh yeah. I don't want to, this is on.
Yeah, everything's off the record. Don't worry.
Yeah. But he's so at that point I think he just retired from international duty. So like you could tell he was kind of like
mailing it in,
more or less.
He listens. He's a big fan.
Big fan. Yeah, but more or less. Yeah.
So did you notice like so were you doing chiro there or athletic therapy mostly?
So that was
in Bournemouth.
So that was part of the chiropractic like college. Like that was in my last year. So in the last year, we do like an internship, like a residency kind of program. So we did like business classes and like other kind of stuff like that. But we mainly already knew like diagnosis and treatment and all that kind of stuff. So we did a full year from like July to July or something in clinic. And during that time in our clinic, I also did that athletic therapy the AFC Bournemouth internship thing. So that was based with a chiro. So like that was specific to chiropractic.
Right.
Yeah.
And so even in the like within the team, within the organization, did they focus on chiro? Like did they take it as, oh, this is something we got to provide for our athletes, or was it
So yeah, they've always had one on staff.
Yeah.
That summer that I got accepted there, one of our professors from the college, which she previously worked with the team too before, but then they kind of switched chiros and they went back to him. He got accepted for the job again.
Yeah.
So he got back to like his old position, I guess. But we would be there like 4 days a week, I think, 3 to 4 days a week. And then the players that needed extra treatment would always come to like our clinic in school.
Oh, okay.
So like the clinic we had in school was like, I don't know, had like 35 treatment rooms or something. I think it's like the second largest in Europe or something like that, right? So it was a big clinic, and faculty treated there too. So whenever we weren't available there, like on the morning before a training session or something, they would then come to us after. The same thing with kind of like the academy players and under 21s. They would come to the clinic. There was a couple times where we went to like watch their training practices and stuff. But they had like therapists and kind of stuff there too.
Yeah,
like
they
had physiotherapy kind of residents, kind of dealing with that bit. And then they'd come to us just like for specific chiropractic stuff.
Yeah, well, that's what I was going to bring up next. So it's like, what is chiro exactly, and how does it differ from physio? Because like we mostly know what chiro is. Like you go to the chiro, he cracks your back or your neck, and you leave feeling better. But it's like, what is actually the mechanism that happens in a chiro adjustment, or how does it differ from physio too?
All right, so we'll start with like physio and chiropractic, right? In that like elite environment, like when you're with like an EPL team, right? That's where you can kind of start seeing the differences. There they had a bunch of physios on staff. They had a medical doctor on staff, like an MD. They had a chiropractor. So at that point, each one of those has their own kind of like specialization. The thing with physio and chiropractic, it all meshes together somewhat. But like chiropractic, like our bread and butter is the manipulation, right? Like the adjustment. We spent like 4 years in school learning that all the way through. So like that's obviously like our main focus. Yeah. Physios can also manipulate. And a lot of the ones I work with now, like they do mid-back, like so thoracic adjustments, and lumbar, like low back adjustments also. Some of them do neck adjustments, like physios in general.
So physio can adjust back?
Yeah. So they have like a different way of doing it. I think they have to go through like a certain course to get it done. And then they have to kind of like register that they're allowed to do that. But the thing is, like mid-back adjustments are, I'd say, a lot safer than kind of neck or even low back because of the kind of the stigma around that stuff too. Yeah. But they're allowed to do that. But it's also like, who'd you rather go to get an adjustment? Like a physio who did like a week course in adjusting, or like a chiro who did 3 years of practicing how to adjust, right? So like obviously when it comes, that's why I think a lot of physios don't want to touch necks in general, because they're not.
They'd rather stick with what they actually got an education for.
Yeah, exactly. And they like, I think maybe like a safety aspect too. Like they probably don't feel comfortable because it is a little bit more, I guess, sensitive. Like people always take it more seriously, right? Yeah. So with a chiro, like you have 3-4 years of practicing that specific adjustment, so you know what to do and what not to do, which might not come across in like a week course or you know, whatever semester of teaching kind of thing, right?
But so what exactly is a spinal manipulation or even like a neck manipulation? So when you go and then it makes that cracking noise, right? But then what's going on? Like what's actually happening?
So the first thing I always tell my patients is like, you're not looking for the crack, because that's what everyone comes in. It's like, oh, like am I gonna get like a crack or whatever? That's just kind of like a byproduct of what happens. Like it's a fun noise to hear. You get a nice kind of release kind of thing, but that's just like gas in the joint releasing.
So your joint's farting.
Yeah, exactly. Yeah, precisely, right? So it's kind of like your knuckle, right? Like you crack your knuckle, you hear a crack, like same kind of thing, right? Yeah. So it's gas? The crack is gas, or is that it's like, that's the theory like behind it, like it's gas being released in the joint. It's like a kind of like a vacuum, and then it pops.
Air or something? Okay.
Yeah. What the adjustment actually is we call it like high velocity, low amplitude. So it's like a quick thrust without too much power. It's all about like speed, right? So you obviously don't want to put too much power in, because like you're just going to start like shearing joints too much, right? And that you cause more damage than you don't. So you do really quick impulses. What it does, it basically helps open up a joint and allow it basically to restore its normal range of motion. Okay. So that's like the main premise behind it. Like you just want to, if it doesn't move, you want to make it move. Basically, I can summarize my whole job into like two lines. If it doesn't move, you make it move, and it's supposed to move. You make it move. If it moves too much, you stabilize it. Okay. That's basically our whole job in a nutshell. So if someone's got a lax shoulder or something, like too much laxity and it's not stable, you're going to give them a bunch of exercises to do to stable that joint. Same thing with low backs, right? Back to the adjustment though, there's other like neurological effects where like it helps with kind of like reducing nociception, which is like your pain response. That's based on the kind of like the pain gate theory. I don't know if you've heard of that.
No.
But it's kind of similar to what like how TENS machines are used for. Your brain sends a pain signal, or like your body sends a pain signal to your brain, right? If you put on like those pads in a TENS machine, it kind of gives you a second impulse into the muscle, and then that impulse goes to your brain. You feel that sensation, which then blocks out the sensation of pain. So it's like a pain gate, right?
Oh.
So one stimulus closes the gate for the pain stimulus, so then you stop feeling pain and you start feeling another one. Okay. That also kind of happens with an adjustment also. When you adjust through, you start getting a sensation of like you get a stretch response in the muscles around the area, which then sends a signal to your brain. It helps relax the muscles around the area also.
Yeah.
So like if someone got a low back spasm and you adjust their low back, it'll help release a bit of that spasm and get joints moving again, right? And then in the same sense, it'll help decrease pain by that same kind of pain gate theory, right? It has more sensation coming in to the brain based on what you're moving there, and then it kind of helps block out the pain reception.
So does that mean that chiro can be only a permanent treatment and not a temporary treatment, not a permanent one, or it can be both? Because when you're saying like manipulating joints and then that leads to pain, right? Pain management, is that pain management, or are you healing the problem?
A bit of both. So manipulation can be kind of like a temporary fix, for sure.
Okay.
Every case is different though, right? So sometimes, you'll have a patient that comes in one adjustment and then after they feel great, right? And like they don't have the problem come back kind of thing for quite a bit, right? So at that point you can kind of say then that's like a permanent fix kind of thing, right? But others, you get one adjustment, but that's obviously not enough to kind of fix the problem, right? So that's why a lot of chiros do like soft tissue work on top of that and stuff, so they help relax the muscle, because sometimes the adjustment just isn't enough to keep going, right? So we do a lot of other stuff, like especially like kind of if you're in the sports field, you do a lot more things on top of just the adjustment, right? People have realized that the adjustment is great, like it for a lot of people it works like wonders, but there's a lot of stuff that you can add on top of that like will definitely help prolong or like increase basically your recovery.
So when you mentioned that sometimes a patient comes in, you treat them and they're feeling great, and so perfect, that's it. But sometimes they have to keep coming back, and I think that sometimes gives people a perception that chiro is a scam because they keep telling you to come back. They have to keep coming back,
right? Yeah, right. Exactly. So like most people's goals as a chiropractor should be like, it's a bad business model, and that's where like the issues come in, right? Is like I like to see my patients as little as possible. So basically it's more of like an ethical approach, right? And I do that by like, obviously within the first few weeks of the injury or whatever condition they have, you kind of want to bring the treatment numbers pretty close together so they can get the most out of the treatment, right? You don't want to have long gaps in between. But then as the treatment goes on, you just kind of start branching away and like farther apart, bigger gaps between the treatment, right? Just to kind of, one, you probably won't need that at that point if you've already started like getting down the healing process. But also like a lot of that is giving patients like home exercises to do, to help strengthen that. And I think we talked about this like before, right? The treatment plans where people are really busy in their lives, right? Like everybody is. A chiropractor will tell you a couple exercises to do and
you'll ignore them.
Exactly. So a lot of people tend to do that. A lot of people, so it's not like the majority, a lot of people actually do take your advice, they go through with it, right? And they kind of heal themselves as they go, right? Through their own exercise and stuff. But a lot of people don't. So that's why maintenance care is important, because for those that are too lazy or just don't have the time to go through their proper like exercise routine and like what they actually need to help themselves in their specific condition. So that's where maintenance care does factor in, because we'll do it for you kind of thing. Right.
Well, even like even regular physicians, when you prescribe someone medication, I mean, what's the percentage of patients that actually take the medication as prescribed every day? Right, and that's just taking one pill, or like 2 pills a day, or whatever it is.
It's not like a
and
big ask, right?
Yeah, and that's just like taking a pill with a glass of water, and now you're asking them to do exercise, so obviously that number is going to even decrease.
Yeah, and it really depends on the patient, like how motivated they are to get
better,
to where they need to be, right? Or like how much time they have, and that kind of thing. There's a lot of factors to it.
So, but that's what I don't get is like when people give chiros a bad rep because they ask people to come back. But, I mean, doctors do the same thing sometimes. Physios do the same thing.
Yeah,
It's like, oh, come back and see me. Come back and see me.
But, so we can go back into, like, history with this, right? Like, chiros, I think, get a bad rep because of the origins of chiro.
Right.
Physios used to, or, like, they tend to kind of be, like, buddy-buddy with MDs. They've been, like, more evidence-based from the beginning.
Right.
So doctors can easily recommend physiotherapists because they know they're pretty much on the same side. With chiropractic, like, I don't know if a lot of people know, but it started in like the late 1800s, I believe.
Yeah.
D.D. Palmer, I think David Daniel or David or something like that.
Yeah, he's from Port Perry.
He's from Port Perry,
Shout
actually.
out to Port Perry.
Born in Port Perry, which is crazy when you think about it.
But also it makes sense that a crazy guy like him came from Port Perry.
Exactly, right? Yes, kind of connecting the dots there. But the origin story is he was working at a school, I believe, somewhere in the States, and there was a deaf janitor that came in. So D.D. Palmer was actually a magnetic healer to begin with, all right? So I don't really know.
So he's a bullshit artist from the start.
Exactly. You can take that kind of from the start. But he adjusted, so he was kind of like already studying manipulation, that kind of stuff, and he adjusted this janitor's neck, and his hearing came back.
But so, like, this guy was learning manipulation or adjustments on his own? Like, since he's the founder of chiropractic, that means, like, there's nothing for him to rely on before that.
Exactly.
So who was he adjusting? Like, what's he doing in his spare time?
I think one of his first patients, I don't know if it was the janitor actually was his first patient, but, like, one of the first patients was that janitor.
And he's like, hey, come in, let me try this.
Yeah, and then he's like, oh, this is, like, clearly this works. Like, let's keep this going, right? And then from that point, his son, BJ Palmer.
Hilarious.
Yeah. Then kind of took it into more of like a marketing thing and then made it so much bigger. Like, I think there was even like somebody wrote that like he kind of like started taking over the school that that D.D. Palmer started, and then kind of putting it his own kind of like belief system into it, right? So that all started with like their main belief system was on innate intelligence. So it sounds weird, but the whole principle kind of behind it is that your body has like an innate like intelligence flowing through it.
So like your organs, your muscles, everything have their own intelligence built in.
And the way that travels through is like your nervous system. Okay. So if you have a joint in your spine that's blocked and it's like blocking a nerve or irritating a nerve, your innate intelligence can't flow through that spine nerve, which then innervates, let's say, an organ like liver or something, right?
Okay.
Because of that, then you get like liver cirrhosis.
So, okay, aside from the term that they use, the innate intelligence, blocking a nerve, in reality, like based on evidence, does it not actually lead to worse complications or medical conditions, or is that all not true?
So there's nothing in research that actually shows that like that kind of the subluxation complex is what they call it. Like the subluxation is the joint restriction, that actually causes any kind of actual like conditions like that,
chronic illness.
Yeah, exactly. Like more like visceral kind of illnesses, right? Yeah. So based on like BJ Palmer kind of his theories, he said that like by adjusting you could cure, I don't know, like diabetes or something,
right,
or like cure cancer with an adjustment if you targeted the right nerve kind of thing, right? That's just sounds wacky to begin with, right? And then they started on that whole premise, and there's some chiropractors that still kind of believe in that innate intelligence, and that's where that bad rep comes from.
Okay.
So
yeah, because it was founded on BS.
Exactly.
But so was regular medicine at times. I mean, don't get me wrong, medicine is like such a broad field that some parts of it were legit from the beginning, some parts of it were BS, but when medicine started, most of it was BS. They were giving like ostrich eggs to people, and they're like this cures you. And if it doesn't cure you, then you're the problem, not the medicine.
Exactly, right?
Right.
Yeah, they would literally tell patients that it's
most
if this
of medicine
work,
was
then
based on BS. It wasn't until like the 20th century, I think, that randomized controlled trials were actually
starting to
be
make
the
a
common,
difference.
starting to be the gold standard.
Exactly, right? And so that philosophy started, and then everybody that went to that part of like through that system then grew up on that philosophy, right?
Right.
So there's a lot of people that still believe in that, unfortunately, and that's where that whole anti-vaccine thing comes from too. So I'm sure you've heard of that. Like
Yes,
how people
because people say, "Oh, chiropractors are BS artists because they're against vaccines and they're
so
whatever."
they think that innate intelligence can save you from all these illnesses and you don't need a vaccine, right?
Right.
So the PSA to everyone: if your chiropractor tells you not to have a vaccine, run in the opposite direction.
Yeah, but here's the thing: like, if you're gonna go to a chiro and he tells you that he can cure diabetes if he adjusts your knee or your back, or whatever, hey man, that's on you. Okay, if you believe that. That's on you, not on your chiropractor.
Yeah,
you're even dumber than your chiropractor if you believe that. And then you go around and spreading rumors about chiropractors. Like, why did you believe that in the first place?
Yeah.
Well, I would just use my common sense and be like, no, I'm walking away.
Some people are gullible, right? I don't know. I like a lot of that is like a scare tactic, right? It's like if you don't come to me 3 times a week to reduce this subluxation that you have, then like like down the line your condition might worsen and like you could die. And like people hear that and they automatically assume like, oh, this guy's a doctor, like I should listen to what he's saying, right? So yeah, that kind of took the whole profession down the wrong road.
Right.
And now that research is becoming a huge thing, I think generally like everywhere, right? Like research now is kind of shedding light on a lot of different things that chiropractors can now finally focus on, like what we're actually supposed to be doing. And I feel like a lot of chiropractors need that extra kind of like, oh, we do this, we do that, like just to kind of boost themselves up. But we can go into like just low back pain alone. Like if chiropractors, we'll go into studies and stuff, but if chiropractors just focus on low back pain, that's it, we'd help the world a lot. Like the Lancet, a medical journal, it's like one of the oldest journals, it's a really reputable source, right? They brought out a series on low back pain alone, like a couple journal articles basically, that now, I think this came out last year or maybe early this year, I believe. I think it's early this year, that low back pain is the global now leader in disability worldwide.
Fuck.
Exactly, right? Like that's low back pain. Like in 2016, I think it was 2.6 million people went to the emergency room in the States just for low back pain.
That's insane.
And 60 of those, like 60% of those people, which is like over 1.3, 1.4 million, got opioids for their pain.
Right.
And then that just cycles out of control, right? We kind of all know where that's going. So if you just focus on that alone, like the chiropractors can help a lot in that. I think in the States, the economic kind of burden that opioid crisis has done is like $80 billion or something, based on like loss of productivity in work, basically surgeon costs and that kind of stuff, like doctor costs, addiction treatment costs, socioeconomic costs, like all of that together is like somewhere in like the 80 billions.
Holy hell.
If you factor like all that stuff in. Obviously that can't be like, it's not like a perfect number because that's a lot of estimates from everywhere, but in the States, I think that's like the States alone. That's from like one of the national health societies in States. I think they came out with that number. Because
I think even the people who argue against chiro would agree that the opioid crisis is actually a legitimate thing, and it's like it's taking over.
Yeah. And I think it is like, I think I saw a stat where it was like 4 out of 5 like people that were addicted to painkillers, like opioids or whatever, then went on to try like heroin or something, or got into like harder drugs, like as in like it is a gateway drug.
Yeah. So I used to work at a pharmacy, and then we had a methadone dispensary too within the pharmacy, right?
Yeah.
So for people who don't know, it's for recovering heroin addicts. Yeah. So I used to assume that everyone that comes in was just a former heroin addict, and now they use daily doses of methadone to
try to like wean off.
Yeah. Although methadone, once you're on it, you're most likely not coming off of it ever.
Yeah.
Either way, I used to think that they're all just former drug addicts, right? But when I talk to them, sometimes the pharmacist is getting their dose, so I'm just talking to them in the meantime. And a lot of times I find out they're just in bad car accidents. They're prescribed a lot of painkillers. Now
they're stuck.
They're stuck.
They're in the cycle, right?
Yeah.
Yeah. And I believe, there's in New Hampshire. So this is probably from like 2 or 3 years ago. Apparently, it's the second state in the United States with the highest like drug overdose rate. And they did like a retrospective study where it was based on opioids and like chiropractic treatment, like for low back pain, that stuff, right? So people who took or had low back pain and went to a chiro had a 55% chance or decrease in taking opioids. Like just that was
your risk
like
of taking opioids.
Exactly. If you just went to a chiro, like
Right.
your risk automatically dropped to 55%
Right.
of having to take opioids. And like that alone, that 55%, like if you add that to like the other math that we did, right, then that's still like millions of people.
So why do you think then the chiro still has this bad rep? Is it just from the history of chiro, and then people can't get over it, or maybe they haven't just re-updated their knowledge on chiro and what it is today?
I think, yeah. So a lot of it is like recent research coming out, and a lot of it is, I think, still people from the old kind of philosophy,
Old school way of thinking.
still pushing that along kind of as we go. Like it's a lot of the 1% kills it for the rest, right?
Because they're the loudest. And
They're
they have
the
the
loudest.
most influence.
Yeah. So like now there's a big evidence-based group that's kind of like pushing through in chiropractic, where they're actually pushing the evidence-based route and like going by the book, kind of like work with what we know works and stop like insisting that other stuff works if you can't prove it, right?
Right.
If you can prove it down the line, perfect. But like in order to get our reputation back to like what it's supposed to be, stop peddling the stuff that you can't prove and just work with what you can, or
Right.
like what you know works, right? And it's like the 1% that, like we said, the 1% that is the loudest and kind of ruins it for everyone else. And yeah, there was a funny thing too. Like I asked one of my professors back, I think this was like the last year I was in school, and I was like, what do you say to all the people that say like chiropractic is like a joke and all this, right? And he just said Harry Shipman and then walked away. So I don't know if you know that Harry Shipman was an MD who basically was a whack job. He's probably one of the worst serial killers like in our century.
I looked them up. Yeah.
You looked him up?
Yeah.
Yeah, I think I have some stuff. It was like the late 90s, I think, when he got caught. So yeah, in the late 90s, he got caught for killing 15 people, right?
Patience.
Yeah.
Yeah.
So that's what he got caught with. The coroner, I think it was, that found like that all of these people were kind of left in the same position. Like they were all sitting up and like their clothes on. They're all kind of died in the same position. He found like it was really weird that this was kind of happening in the same period of time, right? So he dug into it a little bit more and realized that they all had a visit to this doctor recently, right? It turned out that the doctor was then like giving them morphine overdose just for the fun of it. Just because he could.
Because he's a serial killer, and that's
He's
what they
a
do.
psycho, right?
Yeah. More like Harry Shipman, am I right?
Nice. Yeah. So the worst thing is he then went back and like started basically writing bullshit in his patient notes. Like he would go back and change it and say that they had a diagnosis of like something
that
like
required
cancer.
what he gave them.
Exactly. And he was giving them pain relief, right? And then a lot of these patients, or like the people that died, their families would be like, we never knew that they had this condition. Like,
Right.
nothing was wrong. How could we miss this, right? So they kept digging in deeper and deeper with that, and they realized that he was obviously not smart enough to be an MD, because every time he changed the records, it showed the date of when he adjusted the record, like the medical record. Like you
So
could,
he just didn't know how to use a computer.
I guess so.
Yeah.
So like you could literally see when he last changed the record, right? So they went back to that, and then he got charged for 15 life sentences for those 15 people. But then they went through an audit of like his actual patient notes and stuff, and they think he actually killed like 230 people over a course of like 24 years of like his
Christ.
doctor career.
Jesus Christ.
And that's a doctor that you're going to for like, hey, like my head hurts, can I get like a pill, right? Or like I have the flu, can you help me out?
To be fair, that's a very extreme example.
Oh yeah, 100%. Yeah.
Like that's not.
But so that was just one of the things. He's like the one tutor I had, right? The professor, he was just like, yeah, that's like the one thing, right? Like, it's the worst 1% that ruin it for everyone else.
Right. Because there are also a lot of, I mean, maybe not doctors that are killing people, literally 200 patients, but there's also a lot of them who are lazy and just like, here's the painkillers, just take this, take
Opioids,
this.
that's how opioids started, right? Yeah. So yeah, here's the strongest painkiller we got.
But we can't go ahead and say that medicine is BS because there's a very small percentage of them that are not doing their job properly.
Exactly,
Or they're spreading false information or giving unnecessary prescriptions or anything.
Exactly. Or they're just not, like, they're doing their job. They're just not going deep enough, I guess.
Yeah.
Right? Like they should know the risks associated with opioid like prescriptions. And they should probably restrict that to like a certain population that other things don't work. Right? But
we can't paint everyone in the same brush.
Exactly.
Is exactly what we're trying to say here.
Yeah.
Is like, you can't say, I hear this all the time. It's like you go to a doctor and your doctor wasn't that good. Like, oh, doctors are just like, they don't care, blah, blah, blah. It's like, no, that was just the one guy that you went to. Same thing with the chiro. You go and he tells you, hey, I can literally put your leg back together and like, no.
Yeah, I can fix your fraction in one adjustment. No, but yeah, that's the thing. So, if you don't like your chiro, then go try another one. That's the thing. A lot of different chiros do a lot of different things. There's chiros that do specific pediatrics, right? Or they do specifically the geriatric population.
So the pediatric one, that's interesting. So it's like on babies.
So that's another.
Babies. So how is that?
See, I wouldn't use the word adjust. So we had a lot of pediatric patients come into our clinic, like in Bournemouth, right? And we had one of the professors that she was like did a ton of research in pediatrics, and she was like really good and helped like boost up our reputation basically in it, right? None of the people that we had or the professors or any of the interns ever actually adjusted a baby. Like there used to be a video going around the internet of like the one Australian chiropractor who adjusted a baby. Like you could actually hear like a crack go off and everything. And then he got like everyone lost their mind and he got, I think, like banned for a year from practicing and that kind of thing. Right. So nobody I know, I've never seen that, or nobody I know has ever done that. It's all touch and hold. So with a baby, like, their physiology isn't like developed obviously as anyone else. Right. So it's literally all they need is just a little pressure. Like you just hold the segment that's like restricted or like a muscle that's tight, whatever it is, and you just hold it for a couple of seconds and it'll kind of like just melt away, kind of like butter. And then that's how you know how it's like eased off.
Because
so there's no force.
Musculoskeletal system is so soft.
Exactly. Yeah. It's obviously underdeveloped, right? If there's some babies that came in, I think like 4 weeks in, 4 weeks, 5 weeks after birth. Like, you know what I mean? Like they're as newborn as it gets, right? Yeah. So you're not putting any force through. You're literally just touching and holding.
Right.
That's the only thing and that's a big thing too. Like birth is a traumatic thing, right? Like some people like haven't seen videos or anything, but some of the techniques they use, they have like suction cups that they put on top of the head and like
for the baby,
pull the baby out if they can't get like the shoulders through, right? So like if you can picture what that does to your head, like it totally elongates your head, like as you're pulling a baby from the head out of the.
Dude, I never thought about it because I always think about birth from the mother's perspective. It's like the poor woman has to push a baby out of the tiny hole. What about the little baby coming out of the tiny hole?
Who a doctor is pulling by their neck, like, ripping it out.
Imagine you coming out of a very tiny canal.
Yeah, so that's why a lot of babies end up coming to or came to the clinic because of that, like traumatic. Like they'd always you can see it's hard to, I guess, get obviously a good answer from a baby. But you could look and just see that they're always like, let's say their head is always tilted to the one side, probably because they have a spasm in one of the muscles in the neck that's constantly getting them there after probably a traumatic birth, right?
So really babies can have spasms and everything just like us?
All the same. Well, like, not everything like us, but neck issues are definitely, I think, a huge part of babies kind of like development and stuff, like in the chiropractic part of it. That's a lot of what we focus on. We as in like me, I don't really do that kind of thing, but so we tend to do a lot of that. But again, it's just touch and hold. It's not like an adjustment like you would with a fully grown adult, right? Like you got to be smart about it.
So how does chiro differ today from back then when it was started and all the nonsense that was
So I think
part of it.
I think a lot more techniques have come into play. Whereas before it was just adjusting and then that was kind of it, right? Whereas now there's a big broad mesh of, I think the physio and chiropractic thing has kind of meshed into one. It's all basically about just treating the neuromuscular skeletal system, right? So any issue you have with like bones, muscle, ligaments, we can help you out with. Same as a physio. In the clinic, like I use like laser therapy stuff. So it's like modalities that physios use also, right? Like it depends on the patient. Like I'll adjust patients too, but if I don't see or I don't think it's a good fit for that patient, then like why would I do it, right? So I'm going to use other techniques. There's a lot of other like specializations in it too. So like sports chiropractic is like kind of its own thing. They need
their own licenses.
In Canada, you need to have like your own degree to be technically called a sports chiropractor. There's other like there's chiropractors that specialize in just jaw pain, like just TMJ dysfunction.
Really?
So that's another thing, like specifically that, or like pediatrics, like we said. So there's a lot of like niches in it, and I think a lot of chiropractors are starting to get like onto other treatments too, because if it helps the patient, then that's what matters, right?
Right. But I meant like, how does it differ today in terms of the evidence-based approaches that are here? Like, because I hear all the time, and I'm a big fan of Joe Rogan, and I listen to his podcast all the time.
Oh, that's another,
Yeah, but he always goes off about how chiropractic is not an evidence-based, healthcare sector, whatever you want to call it.
He's listening to the wrong chiropractors.
Okay.
Right? I think he does have a bit of a tunnel vision there. He had that one, I forget what her name was, but she was like...
Yeah, I think she was a journalist. I'm not too sure.
And
what
like
her job
journalist, I think is used like lightly. I think she just wrote blogs and stuff.
Okay.
Like I'm pretty sure I looked this up before, and like
I have a blog. What are you saying?
Yeah. Okay. Yeah. Fair enough. You're a journalist now.
I am a journalist.
You are a journalist. So she looked up the origins of chiropractic and just used that through her whole defense of like how chiropractic is bullshit. Basically,
Right.
She took that one thing and then didn't look at any new research or any new evidence. And I'm part of like a evidence-based group, kind of like on Facebook, and they have tons of chiropractors there with constantly posting new research and stuff, which like helps the profession too, because you learn a bunch of different things, right? But there's a couple guys on there that are just geniuses, basically, right? And all of them, like, there's a couple that have been saying that they've been like emailing Rogan to like get them on their show, because like I'll give you the facts, like I'll cite you the paper that shows that we help with this, we help with that, we help with this, and like they've gotten nowhere, right? Or there's other podcasts where he's talking with like fighters, and if they mention that they go to the chiropractor, he'll like he'll be like, oh yeah, okay, and then he'll just right away he'll just like change the topic, right? It's like he doesn't give it the light of day, I guess, based on that one podcast he had or his own personal experience, right?
Which is weird, because he does seem to be very open-minded.
Exactly, which is weird because
but I don't get why he's not being open-minded about this particular.
Yeah, but then he had his one, I guess, bad experience with it, and then he just sticks to his guns on that one. But,
and so what I noticed, and I'll probably link this video in the description, but what the lady was saying too is that she was always mentioning and citing the BS artists that started the Chiro, so the Palmer guy, and also the ones that claim that they can cure diabetes and whatever else you have.
Yeah.
But she never talked about the ones that are just like, no, this is exactly what I do as a chiropractor. I adjust backs, I help with this and that, and that's it. I don't claim to be a healer of anything else. She never really mentioned any of those. She only mentioned the crazy ones.
And that's kind of going back to what I said before, right? Even if chiropractors just focus on low back pain, we have a huge population to work with. Right. Like, it's the leading cause of disability in the world. So even if we just focus on that one thing, like, we'll still help a majority of the population.
But do you think that chiro sometimes may have that chip on shoulder kind of thing, where it's like, no, I have to do everything because that's...
I guess, like, obviously you as a profession, like, you don't want to like just lower yourself just to like low back pain.
Yeah.
Like, you can do a lot of good that you can do, right? So like, why just limit it to that? But then people take it to the other extreme and say like, oh, hey, I can cure diabetes now.
Right.
And they don't stick within the guidelines or like their scope of practice, right?
Right. So would you say that these are some myths and misconceptions about chiro? Like, that's my favorite question to ask people who come on. It's like, what are some myths about your field that everybody believes is true, or most people believe are true, but you know, based on your education, that this is not true?
One of them is like, once you start chiropractic, you have to keep going. That's kind of like, that's a myth. You don't have to. Like
Right.
you just
Once you, when you go once to a chiro, you don't, and he tells you keep coming back, you don't
exactly.
have to come back.
There's been stories that people like chiropractors have told their patients that they've come in like 3 times a week for like a year.
Mm-hmm.
Like that's insane. Like why would you keep going after?
Just because he told you to, or she told you to keep
like if
coming.
you're not noticing a benefit after like a month or something of constantly going, why are you still going for 12 months? Do you know what I mean?
And
Like,
this is coming
figure
from a
yourself
chiro
out.
himself, who that's how you make your living.
Yeah, exactly. Yeah, like it's not like you gotta sometimes use your own logic, but that's the thing too, where like there's scare tactics that go into that. But
Do you think
I guess,
sometimes
like-
that other than the chiro telling you to keep coming on, and also there's that like when you hear an authoritative figure like a chiro or a doctor telling you something, you'll just believe it right away most of the time.
yeah,
But also, do you feel like some people actually get addicted to this release that you
oh,
get
100%.
when you
No,
go?
there's definitely a couple patients who are
Addiction is a
like,
strong word, but you know what I mean.
yeah, no, definitely. When it comes to like opioid stuff, like it's
yeah.
different, right? Some people come in just to start feeling better. That's all it is. Like everybody has like an ache here and there throughout their day. If you're sitting at a desk for 8 hours a day, like that's your job, like your posture is probably shit.
It's true. It's so rare for anybody who has a full-time schedule not to have aches.
Yeah, exactly.
Like, as a part of your daily life.
Yeah. And even like you come to a chiropractor and like you get rid of that little ache. That's like one less thing that's bothering you throughout the day, right?
Yeah.
And you just feel that much better. People say like they feel a little lighter or like easier to move. Like their mobility has definitely increased because
Right.
that's our main goal, right? Is to improve range of motion. So yeah, they get benefit from that, and that is part of like I guess a good maintenance care. But if like that's the patient's goal is to just feel a little bit better, then that's a viable reason to treat them, right?
True. You can't deny treatment just because
Yeah. Like there is points where like if a person's coming in, there's like, oh, I got nothing to treat here. Like you really don't have anything. And they show up just because they're showing up, right? It's their usual appointment. They show up and it's like, well, I'm not going to treat you because I don't need to. Like there's nothing here, right?
Right.
There's nothing. You're not coming in with an ache or a pain or any issues. You're just showing up because you had a booked appointment and you're showing up, right? It's like I don't have to treat you, and I
Right,
probably
well,
won't because what's the point?
a lot
right?
similar to medicine, where it's like if you go in, like, no, doctor, you have to give me this method of treatment, that method of treatment. The doctor could go, no, you don't need
yeah,
it. So no.
exactly, yeah.
Right. Makes sense. So when a person comes in, this is where I always wonder about chiro. When a patient comes into you and it's saying, I have back pain or neck pain or whatever, like take me through your process as a chiro. What are you looking for? I guess it's different for back or for neck. Let's go back, for example.
So
what are you looking for in the person? Like, how are you approaching this treatment?
So the first thing, like every assessment is like you sit down and just take like a history, right? General stuff like where it hurts, when it started, did you do some specific, like what kind of pain is it? Like, is it worse at the end of the day, beginning of the day, that kind of thing, right? So that gives you like a better idea of what you're actually looking at. And then as a safe bet, you always start from the worst possible scenario and then work your way down, right? So like in school, we were constantly taught different conditions, diagnosis, right? So you have like in the back of your head, you just have a list of things. Like someone comes in with neck pain, like you probably already have a list of like 10 things that could be the issue, right?
Yeah.
And then you just start just narrowing it down the list, right? And you do that through your assessment, right? So usually start with like blood pressure, like vital signs, that kind of thing, like pulse, breathing rate, that kind of thing. Excuse me, even like temperature. If you're like ruling out taking someone's temperature at a chiropractor's office, like it's pretty rare sometimes. But depending on like what you come in with, that right there, it could rule out like an infection, right? Or like a fever or anything like that might lead to like another cause, right? Just that one test. So you do that, and then you kind of slowly go down the route. Like we'll do like neurological testing, like doing your reflexes and sensation, that kind of stuff, muscle strength, just to see if there's like any real issues like going on there. And then you go down to like orthopedic testing, which is kind of testing more specifically certain parts of what you're doing, right? So like for shoulder tests, there's a bunch of different ones. Like there's a specific test for like, let's say bicep tendon that comes in the front. There's a test for like just general rotator cuff stuff that isn't that very specific, but like it gives you a closer idea. There's tests for like AC joint that you can see if it's positive, if it's negative, you can rule out that specific part of the shoulder, right? So all it is just basically like a narrowing down the list of
Of possible
things that you can,
diagnoses.
and then you try to narrow it down to like what you think it most likely is and what it probably is.
Right. And so, but then you go ahead and you move on to the adjustment part of the.
Yeah. So then I'll tell like the patient like what I think it is, what I can do to help them, like what are the risks of treatment, what are the benefits, how long it'll take, and that kind of thing. And then if they're okay with actually going through the treatment.
So as like anybody listening who, let's say in the future or right now, they have back pain. Okay, you just know it's back pain. Would you recommend that a person like that goes to the doctor right away or goes to see a chiro first? Because how can a person really tell the different natures of back pain and which treatment is better and all that? So
with back pain, prevalence is huge, like we went over again. So I think it's hard to say when you say it like that. I would recommend a chiropractor just because chiropractors are more specific in diagnosing low back injuries or conditions, whatever it is, right? Like we have a little bit more like some doctors, don't get me wrong, some doctors are great and they'll actually do like orthopedic testing and stuff like what we do just to try to rule in or rule out some things, right? There's other doctors that just consider it either like pathological low back pain where it's like worst case like fracture, cancer, that kind of thing, or like non-specific low back pain is what they call it. Like they can't really figure it out. It's coming from the joint, muscle, whatever it is.
Or for whatever million reasons that could
exactly. You come into a chiropractor and like office and we'll do a little bit more of a assessment and we could probably tell you if it's coming from a joint, a muscle around the area, or like a disc or something like that, right? We'll be a little more specific. Again, this is like a generalization. Some doctors are great.
Right, of course.
But some doctors just kind of write you a prescription, be like, here you go. So again, it all depends on who you see. Some doctors will give you a referral to see a physio, right? They'll see low back pain and be like, all right, either get x-rays because they think it might be something worse, or, go see a physio or go see a chiropractor and they'll help you out there. So
what's like the most common source of back pain that people can avoid so that they don't even have to go see a chiro or a doctor or anything? So as a form of like primary prevention. So like just in general, like without narrowing it down to a specific condition, exercise, like just general exercise is like the best thing you could do. Even with low back pain, exercise is huge. Just walking, sitting down, like sitting in bed lowers your chance of, or kind of worsens your chance of recovery. Yeah. Right. Swimming good?
Sorry?
Is swimming good?
It's good for a lot of things because like you don't have like the kind of gravity pushing down and you're like non-weight bearing, right? You don't have like the pressure going through. So it's good for like people if they want to get mobilities in hips, shoulders, that kind of thing. Okay. When it comes to low back pain, then again, it really depends on the condition you have.
True. Yeah, of course.
Because, you could either aggravate it or not. If like, there's a lot of different things. Like if you're flexion intolerant, like if you can't flex forward or if you can't flex or extend back, then like that kind of narrows what you want to do and what you don't want to do to aggravate it, right? And swimming kind of has, depending how you swim or what stroke you're using, that kind of changes as you go through. But yeah, exercise is huge. Just general exercise. I don't mean like go and weight lift, start lifting weights, just walking, just general walking, that kind of stuff.
Just your basic exercise.
Yeah.
What about posture too? Because I noticed that my posture is terrible most of the time, and even if I'm cognizant of it, you just forget. It's like a habit that's kind of ingrained in me, and I noticed that most people too, not just me.
Yeah. So posture is becoming more of an issue now in kind of two different ways. So like posture is a big thing that people want to help kind of improve before something happens, right? But it's also becoming evident now that like posture doesn't necessarily mean or predispose you to worse pain. So it's hard to describe, but posture doesn't necessarily affect you unless you're having pain or something, and that's affecting your posture, or like that's the leading cause of it. Then you kind of want to fix your posture to help recovery and that kind of thing, right? But if your posture is pretty bad, but you don't have any associated pain or anything, then that's probably just the way your body's built. You know what I mean? So it all depends on the person. Some people have like a pretty big lordosis or kyphosis. So that's kind of like the curves in your back going, right? To get that, like give them an exercise program that'll fix that or like narrow the curve won't be beneficial for them if they don't have any issues to begin with.
But, makes sense? Yeah, it makes sense. But it kind of goes against what we all
Exactly.
No,
Yeah.
but so if you're saying if I'm a completely healthy individual,
Yeah.
and I have bad posture, right? When I sit, I sit like this, or I study like this, or whatever. You're saying that won't lead over time to worse?
It can. So with the neck is a big one too. So if you move your neck like an inch forward, that puts like an extra like pound and a half of weight on your head and on your neck and stresses the joints and stuff, right? So
over time, that's going to lead to
that
complications.
could.
Yeah.
Yeah. So that definitely could. But when it comes to like treating people, there's another thing now where you don't necessarily have to correct their posture that much if that's not like the leading cause of what is going on. Right? Like
yeah.
People take posture too seriously sometimes now.
But I mean, as primary in terms of like before you even develop anything, like in order for you not to develop any pain or anything, before you even before you even have a reason to see the chiro, having a good posture and working on that, would that on the long run help you avoid these problems?
To an extent. So like a lot of people, like I said, take it too seriously, right? And they're constant like sitting upright, like in a perfect position. But then you still need mobility and you still need your spine to move, right?
Yeah.
Like you still need that. So some people fix on it too much now.
So you think we overrate the importance of good posture to like a
so like it's really
to some extent?
There's a hard kind of there's a group that says like you have to like, you know, posture is everything, this and that. And there's another group that says like, you know, posture is good for like if you have an issue with something, then you can help improve that, right? But don't take it to the extreme and like constantly have to focus about posture, because then that just takes away from like your just normal daily life, right? Like you're constantly fixated of, oh, I have to sit up perfectly straight, right?
True.
Not saying that like it doesn't necessarily, like with low back, it's a pretty big one where like if you're constantly flexing forward, that puts pressure on the disc and then helps push that disc kind of out backwards more, right? As you're doing that, like the ligaments and everything in the back start to stretch out. And over time, then you could have an issue where like you lift something in that flexed posture and then you bulge a disc, and then that's when you get like sciatic pain going down your leg or something like that, right? So there's an extent to, right? There's that perfect middle line where like you pay attention to it, but you don't go crazy about it. And that's where people kind of take it either extreme, one or the other.
Take it in moderation is what you're saying.
Exactly. Kind of like everything in life, right?
Yeah,
like
that's true.
it's all about finding the perfect line.
That's true. I guess if you think about it, in some ways, like you have to stay hydrated throughout the day. But if you drink a lot of water and like way too much water.
Yeah. So that's the thing. Like on Instagram, you'll see like a bunch of people like saying like, oh, perfect posture is this. This is how you should be sitting. This is how you should be driving. This is how this and that, right? And then people will take that and like run with it as much as they can. And like that, you don't have to.
But it's on Instagram. So it has to be true.
Well,
no?
grandma's life, right?
What do you think is the profession or some of the professions where lower back pain or back pain in general is the most common? Drivers, people who drive a lot.
Yeah. So a lot of that, exactly that like the flex posture in the low back, right? That's a huge one. I think I previously had like a bunch of transport truck drivers. They're called lorry drivers. In
Englishmen.
So they're constantly driving for let's say 8 hours a day, depending on the person, like what their trips are. Let's say like they're in a seat for at least 4 hours, right? In that flex position, those ligaments are going to slowly stretch and stretch and stretch. And then on top of that, if they have to unload the truck and move boxes and they're lifting stuff, that's when that's like the final straw, right? That broke the camel's back kind of thing. And that last lift could then, they feel the spasm go, or like the muscle tighten up because it's strained, or a disc kind of goes, or depending on the population, right? So that's one. Again, like just anyone working at a desk is kind of susceptible to that. Desk jobs are rough.
Like probably the most common ones.
Yeah. To an extent, especially nowadays, like 21st century, everything's like technology based, right? Like you're all on your laptops and stuff.
Right.
To an extent, again, like desk jobs, they're rough because of the constant posture that you're put in there, and you're in that position for extended periods of time, right? So that again can predispose you, but that's that kind of extreme of you're in that situation for hours on end, right? The rest of the day, if you kind of straighten up or do some sort of exercise to counterbalance that, then you're perfect. There was like an extreme kind of saying from, I think I read a book by like a physiotherapist, I think. You know Kelly Starrett? No, I think we talked about this. He does like the mobility WOD stuff, like workout of the day and stuff. Anyway, The Supple Leopard. Do you remember that book? No? Okay. Oh, I think it's
You're
Jacob.
exposing my lack of knowledge
Yeah,
about
sorry,
everything.
man. No, it was just talking
Now
to
people are
Jacob
gonna know I'm
about
talking
this.
out of my ass.
Yeah. So there's a book this guy did about like, it's like the encyclopedia of like stretching and stuff, right?
Okay.
Like how to improve mobility and stuff like that. And in one of his recent books, he actually wrote that like sitting is like the new smoking.
Oh,
where
really?
it's like everyone's doing it
Yeah.
nonstop, and like as human beings, we were meant to move, right? We were meant
Okay.
to constantly be walking or doing what else, and like now our society is driven into like a seated
Sedentary,
kind of sedentary
yeah.
posture or the just position just in general, right? So that's obviously a pretty extreme kind of metaphor there.
True.
Or
It is pretty extreme.
but you can kind of see where he's coming from.
Mm-hmm.
And maybe down the line, like, you know, it might get worse.
So is that why they recommend when you have a desk job, every 45 minutes, an hour, you
Get up,
you
walk
a
around.
little bit,
Exactly.
sit
Yeah.
back.
And that's another thing too, where like when it comes to smoking and sitting all day, you then don't have the caloric expenditure, right? So when you go home and have the same meal that you usually do, you're just storing that on as fat, and then that can lead to then metabolic disorder or stuff like that,
Right, blood pressure or whatever it is.
Everything kind of
Yeah,
changes. So that's where I guess he's getting that comparison from.
Yeah, okay.
Where sitting then just kind of changes your lifestyle, which then had to predispose you to a bunch of different things, right?
So you think these professions, then the ones where you have to sit for a really long time, are the ones that are most at risk?
I think they're most at risk for just in general, like lifestyle conditions.
Right.
You know what I mean? Like it's not necessarily like low back pain or neck pain or stuff, but I think you're in more in risk of just general kind of unhealthiness.
Right.
Like you got to really counteract that sedentary job
Yeah.
with like your lifestyle choices after
Yeah.
work to kind of help balance it out, right?
So going back a little bit to the to some of the myths and stuff about chiros, we talked about this a while ago, how there's this misconception for a little while where if you go to the chiro and he adjusts your back or whatever, you were at risk of a stroke.
Yeah.
So where did that come from, and why?
So
where did that belief come from?
that happened because apparently it had happened quite a few times. By quite a few, I mean like, I don't know, there was like 2 instances where it was like publicly known. I think one of them was like an actual, like a model in Britain went to a chiropractor and got adjusted, and she was, I think, like late 40s, maybe. I'm not 100% sure now, but it was like more publicly known because she was like a figure.
She's a public figure.
Exactly. Not on Instagram only too.
No.
So that kind of brought that to the light too. But that's, the research has shown now that just because there's an association there, it doesn't mean it's a causation, right?
Oh, of course, yeah.
Yeah. So what they believe now is that either a person is already in the process of having a stroke and they come into your office and the chiropractic adjustment kind of just, I guess, triggers or speeds it along a little bit more, right? Other research shows that the risk of going to your medical doctor, like your MD, and having a stroke in his office is slightly more than having a stroke in a chiropractor's office. So you kind of, you balance it out, right? With that, like every other kind of recent study that's actually kind of gone through doesn't really support the idea that we actually cause strokes. Somebody, I think one of the studies actually tried putting a number to it, and it was like 1 in 8 million.
Oh, really?
Yeah.
So it could be just due to chance
But
on its own.
Exactly. So another, I think a different study in like 2017 specified that it's activities of daily living, like stepping off a curb, probably has roughly the same chance as like you having a stroke in, because that jolt of you stepping off a curb could then, if you have a clot in your vertebral artery, which that's where kind of the stroke comes from within manipulation. It goes through your joints in the neck, right? So you step off a curb, you get that little jolt, a clot in your artery that's been forming for who knows how long, then shoots up to your brain, and then that's how you get the stroke to start.
Okay. So you, some of the claims that chiropractic care may lead to strokes is based on correlation mostly, and not on actual.
Exactly.
So yeah, I think like for my supervisor always brings up this example when we're talking about correlation versus causation, is that I think it goes like this: like the number of peanut butter jars sold in North America or some state, I can't remember what it was highly correlated with the crime rate in that region.
Really?
Yeah, and so you're saying like, but you see like peanut butter is being sold at a high rate, but crime rate is also going up. Does that mean
Peanut butter is a cause?
Right, peanut butter is a cause? No, it's not, because correlation can, especially if you test a big sample, you're gonna find something.
Yeah, exactly. Yeah, so it's kind of the same thing.
There.
But that's also the thing where, like, if you go into your chiropractor's office, you get an adjustment, a stroke happens because you're already in the process of having it or something. You're going to file a claim against that chiropractor because he gave you the stroke, apparently, right? And then you're going to make a big news thing about that. You're going to go to like the local newspaper, get a whole article written, and then that kind of speeds along the process, right?
Especially if you're in the States and you can sue and get that money.
Exactly. And in the States, they have like, I don't know, 30,000 chiropractors or something. Like it's they have the biggest population of chiropractors in a country. Well, obviously they have like a 300 million population, right? So actually, I think it's a lot more than that. 30,000 is not a lot at all. But yeah, so then, you know, like we said, it's the 1% that makes the biggest noise. Same thing with that.
So I remember we were talking about this one time, is like my one experience with chiros is when I threw out my back. So I was sitting on the floor. I was already in a pretty terrible position, and I reach for the remote and I just throw out my back, and I just stay like this for like 2 minutes trying to get my life back together. And then I go to the chiro once, I think. It didn't help, so I was like, that's BS.
Exactly.
Not gonna go back. Went to a massage therapist, also didn't help. I was like, that's not gonna help either. That's BS. I just waited for like probably 4 or 5 weeks until I can actually walk properly again.
Go through,
Just when
and
got better on its own.
That's the thing. Yeah, like you said, like you went once, didn't find a relief, so like that was it, right? But like chiropractic, I guess, even though some chiropractors try to like sell you the snake oil of chiropractic, it isn't like a treatment, like a one fix all thing, right? You go to the chiropractor for the first treatment. When you're in that kind of spasm, you can barely walk, right? They're not going to do a lot of work with you because you're in that acute stage where you can't really do a lot of work, right? So you're going to start small. You can do like one adjustment or like do a little bit of soft tissue or something, see how you react to that. So you don't like, if we relax you completely and then you get up off the bench, you're going to hit a spasm again, right? Because then you're relaxing the joints and they don't have the stability there, so the muscles are just going to contract and like spasm all over again to give you that stability, right? So even if you do too much work, it's not really beneficial for you in the like long run, or even at that point right there, right? And then another thing is like you go to a chiropractor for like, let's say half an hour, you spend half an hour in his office, like max. What about the other 23 hours in a day, right? Yeah. What, like that one visit isn't gonna kind of help you.
It's not magic.
Exactly. So most treatment plans, I think, wherever you go, or I'd hope, depends on the person, obviously, right? If they have an issue that's kind of like an acute issue like that, you try to get like 2 to 3 treatments in the first week to try to help restore as much function as you can and try to get them a little bit moving. And like at that point, it's more symptom reduction, so it's like pain relief kind of stuff. After that, then you start kind of weaning off the treatments as you go, right? Kind of like I explained before. So you can't expect a lot to be done out of one treatment.
Right.
You kind of need that first continuation just to try to get you through, because it is difficult for you to like at home do a lot of your home exercise or whatever you do in that stage, right? And we don't necessarily recommend you start doing like a bunch of exercises for your low back if you're like you just strained it like a day ago, right? So again, like you got to go through that process, that management plan as the doctor or chiropractor line like has planned out for you, because we do it like specific to your case, right? And that's what we think is like your best outcome or your best recovery is with that management plan. If you go once and don't find a benefit, it's not on us, right? Like you can't expect us to fix what you did in a 30-minute session, right? And
all the bad habits that I've been doing to my to my back
and
my
who knows how you sleep for 8 hours a day,
right?
Even that alone, right? Like if you're in the constant same position for 8 hours a day, like that might be
and
pretty bad for you.
Is that what you're asking, or
Maybe.
like position?
Position.
Oh,
yeah.
okay, position.
Yeah.
So okay, as a chiropractor, if you want to advise people, like, how do you know that your chiro is selling you BS? How do you know when to just walk away from your chiro, and how do you know that your chiro is just not legit?
If you go to him and like with a specific issue, if you try a course of treatment and it's not necessarily working after like a couple weeks, let's say, or you're not getting any benefit at all after like, let's say 6 to 8 treatments, that kind of thing, and you sit down and talk to him, be like, hey, like I'm not really getting much benefit from this, and he doesn't really change your technique or offer you other advice and just keeps doing the same thing over and over again, that's not really looking out for you. So that would be kind of my first bell that says like, oh, he's just kind of doing it just to keep you kind of around, even if it's not benefiting you, right? Another thing is like, I'd be very weary of anybody that tells you that you need to go to the chiropractor like 3 times a week for like even 6 months. That 3 times a week for like any extended period is just bananas.
Right. Unless
you have like 14 different conditions that all need work and he needs to kind of somehow fit it in. But like that's even then
like chiro can really do
exactly right. Like you're probably going to the wrong spot.
Right.
But anybody that does or recommends that's a little suspect. It's another thing. If he starts talking anything about vaccines and like how you don't necessarily need them, or anything about like innate intelligence, that's another kind of like keyword that should buzzword that you should watch out for. Which probably by now is really hard to come by. Like I don't think a lot of people kind of say that.
True.
But there was one chiro I observed while I was still in school. Like I came down and I just observed one of the chiros, and then he mentioned to his patient when he was treating, he was like, yeah, so like my son started getting sick or something, like maybe a flu or something, and in my family that means that he needed adjustment, so like we went ahead and adjusted him, whatever, and blah blah blah. And like as soon as I heard that, I was like, all right, I'm getting the hell out of here.
Man. And
that's kind of those things, like
guy needs his brain adjusted.
Yeah, you might pick up small things like that that just maybe you're not cluing in like exactly what he's saying, but like that's bizarre. Like you're not going to fix a flu by an adjustment,
right?
So if that's his belief with his family, like what do you think he's doing to his patients? Right.
That's true.
So that's the kind of stuff you got to watch out for.
Yeah. So if your chiro starts talking about vaccines and how they're not,
if
you should avoid them and all of that, and then you just like
exactly, it's there's a lot of bizarre stuff, and there's some cases where people have been like adjusted and like they've cured something, or like hypothyroidism or something like that. That's not to say that like chiropractic was the cure to that, but like let's say that placebo's effect is massive.
Oh yeah,
it's huge.
Yeah,
so
huge.
Like you go to a doctor, let's say he's got like a scrub on or a white coat, you're in an office that looks like a doctor's office, you get adjusted, he tells you that like, hey, this is going to help this and that, then that speeds along the process of a placebo response that somehow helps you throughout your treatment, right? So that could happen, but that's not because of the adjustment.
Yeah, so it's the same thing as when you say, oh, my friend went to the chiro and he had a stroke. That's the same logic as saying my friend went to the chiro and now his cancer is cured.
Exactly. Yeah.
It's like, no, it didn't cause him, give him a stroke, and also didn't cure his thyroid cancer.
Yeah.
Right.
Causation, right?
Right.
It's not correlation.
Interesting. So before we end, I got a very important question. You know, on my show, I only ask the most important questions.
Of course.
So I was watching 2.5 Men, right? And Alan, the chiropractor.
Was this the new version or the old version of 2.5 Men?
The old version.
Okay, good. All right.
With, what's his name?
Charlie Sheen.
With Charlie Sheen. No, after Charlie Sheen, don't bother.
Yeah, exactly.
So Alan was adjusting this patient's spine, and then the patient just released the largest fart I've ever heard in my life, right?
Okay.
And then he was like, "Oh, I'm sorry, blah blah blah." And Alan's like, "Oh no, it's fine. It happens all the time. Actually, it's very common." Is it actually very common that you're adjusting someone and they just let one rip?
I think that's happened to me once.
Really?
Yeah, but like to be fair, like it's not that frequent, I wouldn't say, but it. You know, it happened that one time, and like it wasn't.
So you just like
hit
this joint, and like that's connected to some.
No. So it's not like a connection thing. It's like if anything, it's like they relax at that moment, when you give the adjustment and they relax a little too much and they let one rip, right? It's that kind of thing.
So it's just like, they're too relaxed. They're in the zone.
And then it's a quick little like impulse or something. And like, it's just like a quick movement and like, you know.
I mean, we've all been there where it's like quick movement, right?
Or someone scares you really quickly and
yeah. Or like you're sitting on a chair and I have to get up right away. And then, you know,
it happens.
One, you know, it escapes. Sometimes.
It escapes. Yeah.
It escapes sometimes. Okay, great. Anything you want to plug before the clinic or anything?
So yeah, I work with Neurochangers in Whitby. We're at 2 locations, the Ability Center and on Champlain Avenue, like by the 401 in Thixon. So I work there. If you ever need anything, then let me know. I work with the Okanagan hockey team too. So we're working with like a lot of athletes.
Yeah.
So if you're athletic too, then give me a shout and you need some help with any sport.
You can get him a spot on the roster.
Exactly.
Is that what you're saying?
Well, maybe
if you play your guys right.
Instagram's Dr.Fajfer, Fajfer, of course, and same thing for the Facebook page.
No dot in the handle.
Oh, actually, no, not in the Instagram one.
Doctor,
in the Facebook one, there's a doctor with a dot, and then I can't even figure my own stuff out. Yeah, might as well be.
Get it together.
Yeah.
Yeah. So we'll link all of that in the bio.
Yeah, sure.
Or in the description rather, and yeah. That sounds great, man.
Sweet.
Thanks for coming on.
Of course, appreciate this. Yeah, definitely. Right.